now.
Hello everyone, I'm Junaid Shabbir. I'm a PGY for pathology resident at Hartford Hospital. I graduated from King Edward Medical University, and in future I'm going for surgical pathology at University of Pennsylvania for my first fellowship. And for my second fellowship, I'm applying for head and neck. I have few interviews for that as well. Thank you, Osama, for arranging this. I hope this will be helpful for the medical graduates and medical students. I'll start with the introduction of pathology. You guys can hear me?
Yes, we can hear you.
Okay. So pathology is a unique specialty. It deals with human tissue, fluids, and bodies. The purpose of medical diagnosis and forensic examination. It has two tracks, anatomical pathology and clinical pathology. It's a single residency program open to foreign medical graduates like us, MDs and DOs that are AMGs. It is a 3 to 4 year residency followed by optional fellowship, but for us, it's kind of mandatory. So it has subspecialties like in anatomical pathology, we have surgical pathology, which is further divided based on the systems like neuropathology, pulmonary pathology, GI pathology, and more like that. And then we have cytopathology that is under anatomic pathology. We have forensic pathology. And on clinical pathology side, we have hempath, microbiology, transfusion medicine, chemistry, molecular pathology. So what kind of jobs do we do? We have different settings for that. Right now, I'm working in a general community practice, which is hospital based. Other options are we can work in academic practice, which is usually more subspecialized and it is also hospital based. And then non-hospital based services include private outpatient laboratory settings in which people deal with specific organ systems and they are dedicated to that. Like we have GI Connecticut Center in the state I'm living in right now, and there are services which deal with GU only. And other than that, we can work as medical examiner. We can work as medical director in a clinical lab as well. So pathology is usually not known to a lot of people. Like back home, we can tell people don't know much about it. When I got into pathology, my father told me, "Oh, you are going to deal with urines and blood." So even my father had no idea what I was going to do. And it's a general thing. People don't know much about pathology. So in medical schools, exposure to pathology is not a lot. In my medical school, King Edward, I was exposed to pathology in my second year in histology class, and then in third year and fourth year in general pathology. So most medical schools in US does not require this rotation, and residents in other fields do not rotate through pathology. So in general, people know us through movies and crime scene investigation TV series where we do autopsies either on alien or forensic. There are a lot of movies on pathologists, but the nature of job displayed in those movies is not correct depiction. Our main job, I would say, is cancer management. We diagnose the cancer with their differentials, which can be non-cancer conditions, including inflammatory diseases, infectious diseases. We stage the cancers, and we interpret prognostic markers like PR in breast cancer, Ki67 index in neuroendocrine tumors and carcinomas, this kind of stuff. We also, after when patient is treated based on these prognostic markers are targeted, after targeted therapies, we also assess the treatment response as well. I would say this is my major chunk of my job, staging and grading cancer. So for this, we work closely with oncologists, surgeons, gastroenterologists, pulmonologists, and other subspecialties. And we are critical pillar of multidisciplinary approach to cancer. We have conferences in which we discuss the management of the patients. Four main pillars for that are oncology, surgery, radiology, and pathology. So how does a typical week look for a pathologist? We deal with glass slides at this point. In my setting, I deal with glass slides, but digital pathology is into play right now. There are a lot of centers which are dealing with scanned digital image of glass slides, which are, I would say, easier to handle and more advanced. So we look at biopsies, we look at any lumps and bumps, any masses, any organs, amputations, placentas, and autopsies, of course. So we deal with tumor board conferences in which management of patient is discussed. All pillars of patient management contribute to that, including radiology, pathology, oncology, and surgery. We have daily consensus conferences as well, in which pathologists bring the cases that are kind of difficult, and consensus is needed for the sign outs for those kind of cases. So we have that. And we get a lot of calls from MDs, although we don't deal with the patients, but anybody who is dealing with patient care would contact us. Frozen section. This is the only real-time emergency for us. We don't have any emergencies. If there is surgery going on for patient, we have to give them either diagnosis or the margins, or both sometimes. So, and next is teaching conferences. They are very frequent. Lab administration and hospital communities. Pathology, I would say pathology is the only field with a lot of teaching in residency. Other than that, there is no formal teaching in residencies, but pathology has a lot of teachings. To be a pathologist, skills required are you have to be observant of the details, and you should know what you are looking for. You have to organize tumors in non-textbook conditions, including partial glimpses and unusual variants, because not all cancers read textbooks. So there are a lot of variations. We have to be aware of that. And we have to have a good mental image of what each tumor looks like. There are a lot of variations. There are a lot of unusual things. We should be aware of that. And in general, you have to be oriented. You have to have good spatial reasoning. Intellectual, disciplined, self-directed learners excel in this field. And you need to be a team player as well, who can work with all other physicians. Strong writing skills are required, because writing a report is a skill. So if you have strong writing skills, it is going to help. And important point, introverts, they advertise this. Whoever is going for pathology, most people say, oh, I'm an introvert, I'm not outgoing, this kind of stuff. But there are all kind of people in pathology, and you should be comfortable using a microscope. But right now it's not a requirement, because there are centers which don't use microscopes anymore in US. Pros of being a pathologist: you can control your schedule, depends on the settings, in which setting you are working, but most of the time you can control your own schedule. There are no crisis situations for us. Only thing, as I mentioned before, is the frozen section. we are needed for that. Other than that, no emergencies. And I would say whenever and anybody needs help in aeroplane, whenever you are traveling and they need a doctor, pathologist will not press the button to help because we are not trained for clinical things. Other person who would not raise hand would be a psychiatrist. They are also not trained for this. So these are the only two medical specialties in US where you don't need clinical training or intern year before your training. There is good compensation. Your work hours are good usually in most settings. Low medical legal risk. This is also a very good point for a pathologist. In other specialties like OB/GYN, there is a bigger risk of medical legal cases. So, and nobody is competing for our jobs as a pathologist. In other fields, there are mid levels. Like in medicine, there are nurse practitioners and others who compete for your job. But in pathologist, whatever we do, nobody else can do it. It is very intellectually satisfying field. There is a lot of detective work, and I would say athletic work as well. And there is no patient contact. And cons, a lot of bad smells, occasionally maggots that we can see in autopsies. So we deal with bad smells. This is a common thing. It's an everyday thing. Nobody knows what we do. A lot of autopsies and basement jokes. That's what everybody knows about pathologists, like the most common thing. Other than that, people don't know much detail about pathologists. And whenever you misdiagnose a case, it will be part of the record. Anybody can go back in 10 years and pick up the mistake and tell you like, oh, you diagnosed that wrong. So this is also a con of this field. Everything is saved for years. And we are at mercy of the surgeons in hospital practice. Usually whenever they need frozen, we have to be there, but it's nothing as compared to other people's work. So it's not a very big thing. No patient contact. It's a pro and a con as well. For some people, it's a con. For people, it's a pro. So no clinical training after medical school. Useless in emergency, as I already told. And autopsies. We have to deal with autopsies, but they are required in first year of residency. After that, you don't have to do regular autopsies. Even if you don't like autopsies, you can still continue with pathology. It's not a big deal. So going to the statistics. So this is the residency applicants versus total positions available starting from 1952. When residency programs started in US, there were more spots available than candidates applying. And then in 70s, this thing reversed. Now there are more applicants and less slots. And this is number of programs, number of applicants, and number of unfilled spots. For pathology, in last match, 2023, there were 613 slots. People got matched on 607. US grads included 242, and IMGs included 185. And in 2020, when I got matched, slots available were 603, 587 people got matched. USMDs were 204 and non-US IMGs were 232. So number has decreased for non-US IMGs. It's getting tough for non-US IMGs to get into pathology. Your CV should be oriented for pathology, and it is not a backup anymore for us. So we have to like pathology, and we should be sure that we are going to do pathology in future. For IMGs, number of active applicants and percent matched to PGY positions. This is overall match rate. In 2019, 58.8 foreign trained physicians got matched, and in 2023, 62.4. And we can see trend of going down in between. That was due to COVID, but there will be a big boost in next match and in the upcoming matches. So for 2023 match, there were 166 programs in total. For IMGs, I think there are around 100 programs that offer visa, and we can get matched into those programs. There were 613 slots available, and most of the programs which offer pathology residency are in major metropolitan areas, and matching into pathology is comparable with primary care physicians in percentage wise. APCP training is 4-year residency, but if you want to pursue one track, that would be 3 years of residency. But as foreign medical graduates, we can't do that because job market will be very limited if we do that. So we have to take APCP, both 4-year residency training. And pathology has a graduated responsibility problem. You can't sign out a case in your residency. You need supervision all 4 years of your residency, as compared to other specialties like in medicine. As a resident, you can take decisions for your patient by your own. In pathology, we can't sign out cases. So that's another problem. This is the percentage of IMGs with specialties. The most IMGs get matched into internal medicine, around 41.3%, that is for 2023. And pathology was the second most matched specialty for IMGs with 40.9 percentage, and then internal medicine primary, and then family medicine. So boards are required to sign out cases. So to be a full working pathologist, you must be board certified. And you can be boarded in APCP or APCP depending on which residency track you choose. But we go for APCP, so we have to be APCP certified as IMGs. Boards are at the end of last year of residency. As a 4th-year resident, you take your boards at the end of your 4th year. Subspecialty boards are taken after fellowship year. So we go for fellowships that are 1 year, most of them are 2 years, and then we have to take subspecialty boards. Compensation or salary for the patient, for the pathologist, you can have a look at all these things, and pathologists make, I would say, they are among the people who are making good money. It's not very low, it's not the highest, but it's really good. And another look, average annual compensation. Pathologists get paid really well, 339K. That's really good. And now people have private groups and they make a lot of money, but money, I don't think it's the basic goal for most of us. So we get paid good, our job is good. In my opinion, only thing that is slightly on the not on the good side is length of training, duration of training. 4th year of residency, there are not much residencies which require 4 year of training, and then we have to do subspecialties as well. So only the duration of training is a bit longer than other subspecialties. That's it. Any questions?
If anyone has any questions, you can raise your hand by using the emoji. I will unmute you. I think a lot of the participants in this chat are those who will be applying in residency this year. So Dania Rizwan, MD, asks that what are the working hours during residency?
8 to 5 are the usual working hours. And sometimes we have to come earlier. We have conferences that start early, around 7 a.m. So we have to be in the hospital sometimes earlier. Sometimes we leave late. There is work pending. There are rotations that are easier. Sometimes we can leave early, but 8 to 5 is the time. In some rotations like surgical pathology, I had to stay till 10 p.m. in the night to review my cases so that I would be able to finish them and sign out next day with my attendings. So depends on your rotations, but usually working hours are very flexible for us.
Ali Kareem asks about he has the residency related question that my year of graduation is 2011 and he can I match easily. I don't have residency, but I have 5 years experience in pathology.
Uh, can I match easily? Easily is not the word I would say, because getting matched is not easy for anybody. Year of graduation matters, but at this point, things are slightly in transition. You can get matched, of course, you can get matched. Experience matters. So yeah, there are chances of getting matched. I have seen people who have more than 10 years of graduation, they got matched. But at this point, things are in transition because AMGs are jumping for pathology. Their number is increasing. They also want to pursue pathology. It's not at peak, I would say, still in transition, but there is a diversion for AMGs. They are pursuing pathology at this point. So in order to get matched, you need your CV, your experience, and everything.
I hope that answers your question. Hiba Nadeem asks that what are some of things PDs are interested in hearing during the interviews?
First thing I would say they want to hear is I have taken my step 3 because we are not in touch with clinical side, and passing step 3 becomes difficult for some people. So first thing, your CV should be complete. You should take step 3 before applying or during interview season. Other things, mm, I think they are looking at your personalities. Will they be able to work with you in a team? So this kind of stuff. Are you a team player? Can you handle tough situations? What kind of attitude do you have? So they are only judging you on these kind of parameters. They are not very strict. They are not like medicine, but still there are things that we should have: communication skills, talking skills, writing skills, visa status. All these things matter for us. So I hope I answered your question.
Yeah, I think that was a very good point. And someone has else asked a question that is observerships. So two people have asked this question that does pathology residency requires US clinical experience, and but we can get matched out by only doing steps, or we need observerships and LORs from US.
Okay. So going back to Ali Kareem, he says his score is 260 in CK and his year of graduation is 2011. Your score is really good. You have really good chance to get into residency. I wish you good luck. You have really good score. So your chances of getting matched are very high. And going back to Hiba, second question, what are some things to put in our personal statement? For me, I think only things that we should avoid are the things that depict that we are victims of the circumstances. We worked in hard situations and now this kind of stuff. Personally, I would avoid things uh, like serving humanity and this kind of stuff, because this is, for me, this is internal kind of stuff, not for people. So it is a job, we get paid, it's like every other profession. So I would avoid this kind of stuff. And people in US, I have seen in their personal statements, they usually put stuff based on their life experiences and good things, not the things that are negative or that can be taken negative. So we have to take in account the US culture, which is different than ours. So anything that is culturally inappropriate, I would avoid that. Anything that proves that I'm a victim, I would avoid that. Anything that I'm trying to prove that uh, I'm doing it for others, I would avoid that. It's just a profession. We don't need to act very righteous or anything like that. This is life. We have to just mention whatever we went through, whatever things that motivated us, whatever the things are that keep us going, stuff like that. And next question was, can you step score cutoffs required for pathology and observership? Step score cutoffs are not very strict. Passing steps, taking step 3 is the requirement for some of the basic programs. For bigger programs, higher score matters, US clinical experience matters, observership matters. I have seen people who had no US clinical US experience, pathology experience, and they got matched. I had a friend who got matched on 3 letters from Pakistan. His score was really good, but if you want to get matched at good places, then you need more better skill set. So next.
Next question is again, Hiba Nadeem asks for step 3. I think you have already pointed it out that it is very important for pathology. And Musib Ali asks, should we apply to program which take 1 or 2 IMGs like Caribbean or Middle East, but not from Pakistan and India?
Why not? I would say, why not? If we want residency, we should take all our chances. It's tough to get matched, so we should get we should apply at any place which is offering a slot for IMGs, which is offering visa. We should apply to the place, but if it depends on our motivation level, where we want to get matched, we should target bigger places, but we should also keep in mind that it is getting very competitive. So securing a residency spot is an achievement. It does not matter what place. So yeah, for sure we should apply for places like this.
Okay. Dr. Asad asks, what about a consultant histopathologist applying for a match in residency? Is there any under the table eye in the star sign for them when they see that?
Mm. Consultant histopathologist applying, I would say this would count positive for you, because since you are working already within the field, so it can help like other specialties people applying. If they have experience in their choice of specialty they are trying to go, it is going to help. Yes.
Ali Karim asks that I have heard that pathology salary is low as compared to IM. Job market is not big for patho. Should we make CV for only one specialty or we can make for two? And he also asks about what is digital pathology.
So job market is not so big for patho. Yes, this is true. Should we make for one specialty? I would say if you go to stats that AMC released or ECFMG released, the match stats, you will see there are a lot of candidates whose first choice or only choice was pathology and who got matched. And there were only few people who had pathology as option or preferable pathology. Their matching rate is lower. So if you want to go to pathology, you should decide for once and then put your efforts in that direction. If you're not sure, then applying in pathology as a backup, it's not working anymore, I would say.
Okay, I don't see any more questions, and we are also running out of time. If anyone has any more questions or want to speak, you can raise your hand. I will unmute you. Okay, I guess that's it. Okay, Ali Kareem. Yes, it was very helpful. I think it was a very comprehensive presentation. Thank you, Junaid Bhai, for joining us and answering all these questions. Um, yes, we'll be arranging more sessions. Next week, we will be doing a seminar from a resident in Pakistan, and I will post the link, and I hope you can join us.
Yeah, this was my first meeting, or this is the first time I was talking to people regarding pathology. Maybe I'll be more helpful for you guys in future. I'll be more organized. If you guys have any questions, you can reach me out. I'll help you out for sure.
Yes, it was very great. As of I think you covered everything. And Hiba Nadeem, can we have? Yes, I think we will arrange something in future. We just started it, so for starting, we will be just doing some orientations and sessions, but we will get to the CV part soon. Okay. Have a great evening, everyone in Pakistan, and from everyone who is joining from US. A good okay, good morning, and have a great Sunday. And
Oh,
goodbye. Thank you, Junaid Bhai, for your time.
sure, sure. All right. Have a nice weekend.
Thank you.